We're going to do an intraosseous insertion today. Firstly, we need to consider any contraindications for an IO insertion. That may be a fracture to the insertion site, a burn or infection to the insertion site, or a IO insertion within the last 48 hours. We also need to consider which needle size we're going to use. There's 3 different sizes. We have a pink, a blue, and a yellow size here. And they're all considered based on weight. We have our patient Gary here, who's 6 years old. So we're going to use the Luscombe formula. So 6 by 3 is 18 plus 7 is 25. So the patient is approximately 25 kilos. Gary falls under the pink or the blue needle size here. The idea is to have the needle tip touching the bone with our 5mm line above the skin still. Palpating Gary's knee here, I can see that there is a little bit of tissue around the insertion site. The insertion site is 1 centimetre inferior and medial to the patella, located on the tibial tuberosity on the flat surface of the tibia. Having a feel around that area, I'm going to go for the blue needle here due to the slightly longer length of the needle. I'm just going to palpate the joint to confirm I have the right location for the IO insertion. Now that I have a mark ready to go, I'm going to sanitize the area so I have a hand-free insertion. Setting my drill up with our correct size needle, we're going to go in at a 90-degree angle. So we're going to approach the knee and extend the leg. We're going to insert the needle until we feel the bone. Once we feel the bone, we're going to drill gently until we feel a pop. Once we've felt that pop and we're in the medullary cavity, we're not going to draw back or with no recoil. We're going to remove the magnetic drill from the needle and then unscrew anti-clockwise the stylet and place it safely in the sharps container. We're going to put our easy stabilizer gauze on, popping it over. We're going to have our primed E-Connect set, ready to go. We're going to put that on clockwise. We're going to aspirate this intraosseous insertion. What we're looking for is blood and bone marrow. If we don't get blood or bone marrow on aspiration, that doesn't mean that we've had an unsuccessful insertion. We can try aspirating after we have a flush as well. We're going to flush with 2 to 5 millimeters of a saline solution to confirm we have a patent IO insertion.